Welcome, everyone. This is our June Public Health Roundtable, where we're going to be discussing Pride Month awareness. I am Dr. Charlotte Huntley. I am the CEO of Dr. C.H. Huntley, LLC, and we are a public health consulting firm. And we are based here in South Carolina, which is the southeastern portion of the United States. And we serve large nonprofit organizations by helping them to communicate their health information in plain language, especially the data and the more complicated information. We provide a variety of ways to deliver that in a way that they can easily understand and utilize. I also am the host of the Public Health Epidemiology Conversations podcast, where we publish brand new episodes every single Tuesday, and we've been doing that since 2017. You can tell I'm proud of that part. Let's go around the table and give our panelists a chance to introduce themselves. Let's start with Andrea.
Hello, everyone. It's so nice to meet you. My name is Andrea Lowe, and I own and operate the Social Impact Studio Consulting based in beautiful central Pennsylvania. I work with small to medium-sized nonprofit and government agencies in health and human services arena as they look at their strategic planning, policy development, and program development from either a community-centered or community-engaged lens. And I work with them to be able to really impact and increase and improve the impact to their communities.
Good afternoon, everyone, and happy Wednesday. My name is Jessica Gay, and I am a public health entrepreneur and sexual health advocate specializing in sexual health education among youth ages 13 to 25. I partner with local youth-serving organizations to deliver these services, offering sexual health education sessions, as well as presenting case scenarios related to what I see as a public health servant of the local health department. My goal is to educate the youth so they will be better informed when confronted with sexual experiences. I'm very excited to be here. Thanks for having me.
My name is Harvey Kennedy-Pitt. I am a public health practitioner. I'm a thought leader. I'm also the director and principal consultant at Unstuck Limited, which is a consulting firm based in the UK that focuses on supporting people and their organizations to build capacity through adaptation. And that's in a variety of ways. We run a series of programs, yes, thought leadership, yes, also looking at the expo, but also work with clients across the UK and internationally to help them build capacity whatever ways that we can by looking at their systems and processes and also thinking about ways to improve their efficiency, effectiveness, autonomy, participation, amongst loads of other principles as well. I'm also the CEO and founder director of Black Beauty Health, which is a UK-based LGBTQ plus BPOC charity. So BPOC meaning people of colour, so Black and people of colour. And we're based here in the UK, so this is very much a type of conversation I want to be a part of. And happy Pride Month.
Pride Month is celebrated annually in June in honor of the 1969 Stonewall riots in New York City, and works to achieve equal justice and equal opportunity for lesbian, gay, bisexual, transgender, and questioning individuals. This is a time when the world's LGBTQ communities come together and celebrate the freedom to be themselves. Pride events also welcome allies from outside the LGBTQ community. This provides opportunity to really show support, to observe, listen, and be educated. So as public health professionals, this is, for all of us on this panel here, I'm asking each of you to share what this means to you, your business, and feel free to share an experience. I'll go first, and I would just simply like to, I've thought about this quite a bit. I want to share an experience that I've had with client work, and I'm going to be a little intentionally vague just to kind of protect the privacy of the individual. But the situation, I was working with a client. I work with several organizations, but this particular client serves a very niche population. So I was talking with them, and they facilitated the conversation and really began to explain to me that as a transgender person, they were feeling very isolated, not just in their day-to-day with their family, with their friends, but in the workplace. And the very same workplace that's so targeted to serving these public health causes and, populations and people, but they are a minority group, and then another, like a very meta minority within a minority. and I'm a problem solver. So as a consultant, so my initial reaction is I want to fix this. But really and truly, I settled in and I realized that it was the best thing I could do was listen. I was listening and learning, because if you think about it, they had enough trust. Like we had at least enough of a relationship, a rapport established, that they felt a level of trust with me to even open up and share how they were feeling and to talk about some of these challenges that were very, very sensitive. And so I listened and I allowed them the opportunity to be heard, and then, really ask some questions, because it was an opportunity for me to learn on a whole different level. So when I think about awareness, I think that yes, we need to be very proactively, doing things, but sometimes our best action can be, observing, be listening, be ready to learn and connect with people. And this was about 2 years ago. What I learned from that experience has, I've been able to, use it in different settings. But actually, if I fast forward a little bit, I'm about to be in a situation where I'm in front of those leaders, the very leaders that this person talked to me about. And so I get a chance to interject a little bit indirectly, because I would never do anything that would, dishonor that, break that trust. But it gives me the opportunity to now, implement some strategies, implement what I've learned, and interject what I've heard and witnessed in a way that maybe can help pay it forward in a positive way. So I guess my whole takeaway from that was really the fighting my urge to kind of want to go run and do something to fix it, and really settle into the moment and recognize the trust that was there to be that, to provide that safe space for that person to be heard.
Pride Month is very important to me and to my business. As kind of discussed a little bit more in detail in the podcast, I feel like our essential problem in public health that we're trying to solve is community connectedness, and really being able to build bridges and feeling a part of the communities in which we live in. And so many of the discussions that we talk about today when it comes to our LGBTQ plus community members really relate to how we're not connecting people into community or providing care services for them. And I feel like for me and for us as a field, when it comes to public health and human services professionals, in order to reach the goals that we have set out for ourselves while we join this field, while we want to see our whole communities be healthy, we want to see our families everywhere we live be healthy, we have to care and we have to address the health issues of each of the individuals within our population. And so I feel like it's an important issue for all of us to address and work on. Thinking of a short story, it's related to a more personal volunteer experience that I had for a number of years. I've worked with homeless youth, which for those who may not know, anywhere from 20 to 40% of homeless youth are part of the LGBTQ population. They tend to be the hardest hit and more likely to experience suicides and depression and things and all sorts of things as a result. Both of the organizations I worked for created beautiful spaces of belonging for all the kids who came in. So everyone who walked in that door, no matter what their background was, no matter what issues they were going through facing that day or had faced in their history that brought them to that place, they knew they had a hot meal. They knew they had a place where there were adults who cared about them, that we were going to do our best to support them. And that is the vision that I hope to see for our world and all the work that we do as public health professionals. So that's a little bit about me and why I find this important.
So when I think about Pride Awareness Month, it takes me back to my first public health position. I was working at a sexual health clinic in Fort Lauderdale, Florida. And what I loved about working there was that the staff was mainly gay men. And they were very proud, very, very proud. And being from Virginia, I was not used to that. Virginia is a very conservative state. So just seeing how proud they were, who they were, I'm like, well, let me learn as much as I can from them, because I was doing STD testing in these high-risk communities. So I'm like, let me find out, what's good to say, what's not good to say, because I want to make people feel comfortable. And so just talking with my coworkers, they would tell me about the stigma that they had experienced, the discrimination when it came to just anything, access to healthcare. They've had to change medical providers because they felt judged. And so all of the knowledge that I learned from that position, which was almost, 13 years ago, I brought with me over the years into each position that I've had. And so now that I work mainly with youth, I work with LGBTQ youth as well. And the things that they have told me are some of the same stories that I heard 13 years ago. The stigma is still there. The discrimination is still there. The hate violence is still there when it comes to access to healthcare. Like these youth feel that the providers who's supposed to be providing them a service are judging them, when they're telling them about their sexual history or, that, they're same-sex loving person. And they try to, tell them or say to them, why are you doing this? And one thing that I also learned was that these providers, they need to put away their biases. They need to check their biases at the door. They need to create a welcome and safe environment for all persons seeking healthcare, not just cisgender or LGBTQ, but everyone. Everybody deserves access to healthcare. Using preferred pronouns, the names, obtaining a sexual history that is individualized for that person and free from assumption is also important when dealing with this community. These clinicians, they need to look for trainings that will assist them in learning more about the LGBT community and how to provide services to them. This community needs they need genuine clinicians who want to help them, who will stop judging them, on their life choices. Inclusion is very necessary.
I really appreciate the fact that you mentioned the minority within a minority when using your example, Dr. Huntley, because actually, given the scenario that you shared, it's a minority within a minority within a minority again, because even within that acronym of LGBTQ plus or LGBTQIA plus, oftentimes trans people are still further marginalized. They're still, as are bisexual people, as are people who identify as queer or questioning, because of the history and the timeline of the chronology of sort of, the coming out process for the wider community. Obviously, sort of that acronym almost LGBT almost shows you how it sort of came to be chronologically, and therefore, being a minority within a minority within a minority again, and we haven't even added the, being a person of color or being racial minoritized or being disabled or being a person of faith on top of that as well, because people say, how can you be a person of faith and you're also identifying as LGBTQ? We need a completely different session to really go into that. When we talk about the global south and those who have migrated as part of globalization further north, certainly in the UK, the themes are exactly the same. And so what we're seeing is a lack of education, a lack of understanding, a lack of empathy and a lack of compassion, and maybe an over medicalization of what we're talking about here, because we are actually celebrating Pride Month, and just based on the history of even what Jessica was sharing just now, people tend to say, oh, Pride Month, oh yeah, the sexual health clinic, because just the association between what's happened from the 80s into the 90s and we still see happening now. I think the call from the community is really to try and redefine what we talk about when we're saying Pride. Going back to the purposes of Pride parades. A lot of the Pride celebrations globally have turned into big parties that have completely forgotten about the purpose of what people marched for, and on behalf of the wider global community. There are a few different reset buttons I think that we need to be hitting across public health, across social organizing, community organizing, research, academia, education, to really just revamp the approach that we're taking to how we celebrate Pride, understand the meaning, continue to sort of engage in ongoing education, and all for the benefit of those who are the minorities within the minorities within the minorities. And I say minority again for the other examples that I provided. So, a Pride Month is a fantastic time. It's an excellent celebration. It's an opportunity to come together and reflect. And through my business, what we're doing is just working with a bit of a wider population at Unstuck, because Unstuck is not an LGBTQ plus organization. I did that intentionally because obviously separately, I already run the charity that supports LGBTQ plus people of color. So I really wanted this to be a platform that I could utilize to bring that experience and that conversation in whilst working with wider colleagues who might not be as aware.
It's important for us to critically examine our programs and services. Are we really serving the people that we're intending to serve, and are we serving them in the best light? And I just want to encourage all of you out there, particularly those who are health and human services professionals, to and those who are in a position to really oversee programs and create programs. Look at how you're doing them, what you're doing, and really strategize and critically examine how to do it. And if you need support, feel free to give me a call. I'm more than welcome to help you with this as well.
Basically, messages for clinicians, stop judging your patients for who they choose to love or who they choose to be. Inclusion is very necessary. I also wanted to give a couple of takeaways, additional takeaways. There is a website for LGBTQ plus folks looking for medical providers, mental health providers who are friendly to the community. That website is called outcarehealth.org. It's very user-friendly. They offer a 24/7 crisis hotline as well as support groups. And something else that I wanted to let you all know, I live in Baltimore, so I just wanted to tell you all about Baltimore Pride. It's June 19th through the 25th. Our theme this year is One Love, One Heart, One Pride. And you can visit baltimorepride.org for more information. Thank you.
I think if we go back to sort of the point of why we're here today is really to talk about how we as individuals or the companies that we run or the businesses or the communities that we engage with, how we approach those communities. What do we do? What is our thing? And my thing definitely, if you're looking at any of the work that I do, is all about building capacity. Now, oftentimes you mention capacity for certain people, they think it's, oh, I haven't got enough time, or I haven't got enough people, or I haven't got enough resources, or I haven't got the know-how. And I would just do the same as others and say, if you are thinking about capacity as an excuse or a reason or a barrier to you engaging more with what you currently understand about LGBTQ plus people of color or LGBTQ plus in the wider sense, I would encourage you to get in contact with me and visit my website at www.unstuck.co.uk. That's UNSTUKK, not the traditional sense, and book a session to discuss. It's a 30-minute free session to really think about where to begin, because I think people don't begin because they don't know where to start. And if this is something that's a priority to you or something you've been thinking about, please do reach out. I think I would go a step further to invite you to the upcoming September Public Health Consulting Entrepreneurship Expo, because we're really going to break down, regardless of what you do, how you can start to build more capacity and position yourself to start making meaningful change within the field. Happy Pride. Got to say it again.
This has been a great conversation. Thank all of you for taking some time and coming on here and sharing your insights. I'm a huge fan of all of your work. So it's easy for me to lift you up and be the cheerleader in the background here. But I think that there's much work to be done, and there's something for all of us to do on whatever level that we can step in to be a part of making this better. So thank you all for being here, and we'll see you again next month on the Public Health Roundtable.